Hey guys, how you doing? Frank Gonzalez with G&G Productions bringing you another video. Today it's going to be on protocols again. I'm reading to you straight from the Lee County Common Treatment Guidelines, and today's protocol is in the very beginning, and it's going to be on universal care. Specifically the very first block. I'll put it up on the screen so you can see which one I'm referencing, but it's 200.01 So it's the very first universal care page on the Common Treatment Guidelines book, and I'm reading out of the one that's revised in 2021, which is the newest version, and I'm going to jump right into it. So the goal of universal care is to facilitate appropriate initial assessment and management of any EMS patient and lead to appropriate specific guidelines as dictated by the findings within the universal care guideline. So the following represents age classification, and what I'm going to give you is what represents an adult, a child, and an infant. So for purposes of the protocol book, adult is anyone that's of age 13 years or older or signs of puberty. A pediatric is considered anyone age 1 to 13 or signs of puberty. Infant is considered anyone from 1 month to 1 year of age, and a neonate is anyone from birth to 1 month of age. The first pearl we have here is for purposes of admission criteria, the Lee Health considers any patient less than 18 years of age to be pediatric. So even though I just said an adult is anyone older than 13 years of age, for the purposes of admission, the Lee County Healthcare Systems considers anyone less than 18 a pediatric patient. The other pearl here, for purposes of trauma alert criteria, this is an important one for the purposes of trauma alert criteria, an adult, so who we're going to use the adult trauma triage transport criteria on, or the adult trauma triage criteria, is an adult shall be deemed anyone age 16 and above. So anyone 16 and above, we're going to use the adult trauma triage criteria, and a pediatric patient is anyone 15 and below, and that's who we're going to use the pediatric trauma alert criteria on. Even though at the beginning I said an adult is anyone greater than 13 years of age or signs of puberty, for admission purposes in Lee County, anyone under 18 years of age is considered a pediatric patient. For trauma alert criteria, anyone 16 and above is considered adult. And for trauma criteria for pediatrics, anyone 15 and below would be considered a pediatric for the trauma alert criteria. That's the big one I wanted to bring you guys. I'll put this up on the screen so you can see, like I said, which one I'm referring to, but the first block of goals, that's really the only one that's important or has any valence to it. The rest of them is just basic stuff, BSI, scene safety, when you do your triangle, your assessment triangle, right, your appearance, work of breathing and circulation, and just keep going back and forth and keep monitoring them. On the next page, your CABDE, circulation, airway status, breathing status, disability status, and exposure. We know that. Do your sample and OPQRST. That's from EMT school. I'm not going to read that to you because you know it. Unconscious patients, your AFPU. If you suspect they're having a stroke, your Glasgow coma score, your stroke assessment, pupil response, pain scale, sedation scale, all that stuff. For purposes of IO, an IO will be used in the proximal humerus, and that is the primary site for adults. The primary site for adults is a proximal humerus. It doesn't say shall be or will be. It's the primary site. We can still use the tibialis, the tibiotibialis, anterior tibialis for the IO. It's just that the proximal humerus is going to be the primary site. We can still use all the other sites that we normally would. The distal femur or proximal humerus is the primary site for pediatrics. When we do blood sugar monitoring, they want us to have a target of above 60 milligrams per deciliter or below 300 milligrams per deciliter. Going through some of these universal care ones, not a whole lot of stuff. Priority inpatient, we have 1, 2, and 3 priority patients, priority being the most critical, priority 3 being the least critical. And a priority 1 patient is defined as unstable with advanced life support needed patient requiring immediate emergent medical attention for life and or limb threatening illnesses or injury. Priority 2 patient is a stable advanced life support patient requiring medical attention but not immediately endangering patient's life. And priority 3 patient is going to be your basic life support patient requiring non-emergent medical attention, right? Pretty easy. Going through some of these patient safety, your 6 R's, you remember that from EMT and paramedic school. Really not a whole lot on here. The big thing was that very first block for universal care that I wanted to relay to you guys, what constitutes an adult, a pediatric, child, and an infant for certain criteria. For admission purposes in Lee Health Systems, anyone under 18 is a ped. For trauma alert criteria, 16 and over is adult. 15 and under is going to be a pediatric patient that we're going to use our pediatric trauma alert criteria. So that's about it, guys. If you have any questions, comments, or concerns, be sure to leave those below. Don't forget to hit the like and subscribe button. And thanks for watching, guys. I appreciate it. Again, Fred Gonzalez with G&G Productions. We'll see you on the next one.